So anybody who has any disease, we have for years felt that there are only two components that are important. One is the treatment that is given, and the second component is how easy the treatment is accepted by the patient. So these were the only two components, that the person gives evidence-based care and all that is available in the form of an infrastructure. Long time ago, somewhere in 90s of the previous century, we looked at that we feel we are giving the best. Is that actually being perceived by patients? And we found that somewhere close to about 30% of patients did not complete their treatment. Now, if I were to boast that children with cancer have 75-80% cure rate, that cure rate is possible only if 100% complete treatment. If 30% don't complete treatment, where is the question of that 70-80% cure rate? So that's where we found that we needed an individual in between who will, while talking to the doctor, is perceived as a family member, and while talking to the patient, perceived as a member of the team that is treating. So this individual wears two hats. We run a program called KVET for that, but St. Jude's are the individuals who have shown the efficacy. So with that, we could look at somewhere close to about 95% compliance to treatment. Imagine from 70 jacked up to 95%, we can now boast that yes, there are about 75-80% cure rates, that this child will live for life, 50, 60, 70 years added to the society. And all credit to this component which allows 100% compliance. They had, after discussion with us, an end-to-end solution, that a child comes here and it's taken over. The moment the doctor feels that there is a good cure rate and we can take care of this child very well, St. Jude takes over. They arrange for their accommodation. They arrange funding, which is already subsidized through hospital, but in addition, whatever funding required. If you see the accommodation, it's a place where sometimes I feel I would love to stay. It's that beautiful a place. And with the children who are kind of jumping around, it's fantastically positive place. The kids stay there with their parents, and what we find is that we are able to send individuals for blood collection, so they don't need to come here every now and then. Whenever they are required to receive treatment, they are brought here. All expenses being looked after, the parent doesn't spend a single pie. And finally, arrangements are made for them to be dropped back home to their village at the cost, which means that the basic principle that we had thought to begin with for Tata Hospital is that no parent should shed a tear for the child's treatment or the feeling that the child is unwell. It should be, when they look back, it should almost appear that maybe a small blip there, that's it, and everything is well. So Kharghar facility is a unique facility for treatment of children. One is that is the largest facility for bone marrow transplant. Although bone marrow transplant is less common in children, but that being the largest facility, we need adequate support, and that support lasts for something like 6 to 8 months. The second component, Kharghar also has the proton therapy facility. Globally, proton therapy is proved to be effective and useful in children. So primarily it is for children. Secondarily, it is also used for adults, but efficacy wise for adults, no difference, but children, it makes a big difference. So that facility being there, again, to be waiting for about 2 weeks, 3 weeks of treatment, We need support systems there. That's the reason why the Kharghar facility. There is a separate pediatric cancer hospital that is being built there, which will be commissioned by year end. All that will get the whole of Western and Central Indian patients' children to be brought there. And we need a bigger facility for that, bigger support from St. Jude's. One additional fallout, we feel that yes, children get treated. We now have 2 or 3 children whom we had treated 25 years ago as on staff as cancer specialists, which I find is the biggest achievement that the hospital and St. Jude's can have. The second component, which we had never thought will be there, is that when we visited some of these villages where we sent back children after staying in with St. Jude for treatment, we found that the village had turned very clean. Being in the facility for children here, cleanliness had become way of life for these children. They disseminated that in village that unclean places are not good. Imagine what can make India clean. It's a small effort towards that. All credit again to St. Jude's.